All right, good afternoon, panel. Good afternoon, MCBH. I'm here with Colonel Lianez, Commanding Officer from Marine Corps Base Hawaii, Lieutenant Commander Kuennen, Department Head for the Branch Health Medical Clinic here aboard Kaneohe Bay, and Beverly Hudgens, MCCS Retail Director. Thank you so much for being here. I think this is a great opportunity for us to kind of discuss some of the main topics that have been brought up within our communication channel. So again, thank you. And sir, if you'd like to start, if you have any opening remarks before we get into the questions themselves.
Sure, Captain Martins. One, I want to thank everyone that has been working together for probably over 3 weeks on something that's new to us, that is rightfully something that we have to take seriously and work together on. What I've seen and who I've worked with on the base and also our local community, to a man, woman, and child, we are in it together, and we are united to defeat COVID. So I've been looking forward to a venue like this to answer questions, give my best information on insight of just my role with others, because I think when people know that, they'll understand how we're working together to keep each other safe and defeat COVID-19.
Thank you, sir, and thanks for your leadership during these times. So our first question really comes down to folks here within our community wondering the differences between what they're hearing portrayed by the state and us being a federal entity. Do you have any perspective on the differences and what folks, what information folks are adhering to?
Sure. It is true that when you have a global problem that's new, and you have leaders together that are trying to figure out what to do, and their actions manifest in communicating direction, that likely when you start with different groups that are, you could say, federal or state, that when you get into it and you communicate, that there's going to be differences in what's communicated. I will say that my experience across the past 3 weeks is that there have been some differences between what the state says in order to defeat COVID, and then maybe slightly between the federal side. I will say that that all those small differences, they're all there to achieve the same end state, which is to protect people and stop the spread of COVID-19. I know that in the occasions that the differences have caused different actions, that leaders talk about what's going on, validate why we're doing that, and there is 100% of the time an affirmation that although differences are difference in words, that our actions are actually coordinated to move towards the same end. So I think we'll continue to see, because organizations are different. The regiment is different from the MAG, right? The MAG is different from MCX. That you might see small differences in what's said, but we are all working towards the same end.
Thank you, sir. Lieutenant Commander Kuennen, from a medical perspective, how do you see us here at MCBH on the medical side combating COVID-19?
Thank you, Captain Martins. We're prepared for a potential outbreak of this COVID-19. And we can say this because we've abided by, first and foremost, all the recommendations of the Force Health Protection Guidelines. We always enjoyed a really good relationship with the tenants and leadership aboard this base. Now, like never before, we've communicating lockstep with the Public Health Emergency Officer, with Colonel Lianez and his staff, with our other fellow medical entities at various units, and with the larger entities in the Hawaii health systems market, all with an effort to preserve that health and readiness of our forces. I'll just take the opportunity right now to say, if I could, that the best medicine that I or any of my colleagues would really prescribe would be to just follow all the guidelines that's already been put out there at many different levels, primarily social distancing, hand washing, the good hygiene at home, the great hygiene of at work, and of yourself, really. This fight is, medical, we play our part in this fight for sure. This fight will be won by the individual sailor, the Marine, their family members, all doing their part. That's what's going to get us there.
Thank you,
Yeah,
sir.
Captain Martins, if I could, and I think Commander Cornejo is being kind, that we all owe you in medical and public health thanks. You are the front line. That every day you are in a high-risk situation, and we know that, and we appreciate it. So I know you gave credit to others, but it is not lost on me or anybody else out there that the people that are on the front lines are you guys. So we appreciate it.
It's a pleasure to do it, sir. Thank you.
All right, so the next question, more of a services facilities type question for Beverly. So we've noticed that we continue to offer some services and retail operations and have either diminished or stopped others. Do you have any insight to what services are operating, why they're operating? And for an example, GameStop here aboard the installation is still open. Could you talk a little bit about that?
Sure. When we're looking at our services and retail operations, what really drives the decisions is the customer demand aboard the base and how essential that service is. For example, GameStop is one of our contract partners. And our contract partners, as well as the associates that work for us in the stores, have been very supportive to try to keep the operations running and be able to shore up the readiness of our Marines on the base. And they're taking measures to make sure that they can do this safely. If we can't do it safely, then we won't do it. For example, GameStop only allows a maximum of 6 customers in their store at any given time, so they can ensure social distancing can be maintained. It really doesn't have, the decision is not on how much money we're going to make. That's not the way we look at this. That's not the filter. We track transactions in our locations that indicate to us what the customer demand is and what our Marines want. We look at the days of what time of day that the customer demand peaks, so we can move our resources around and make sure that we're able to provide the service in the way it's intended. And I've been really pleased to see the dedication of the associates, that as soon as the containers get in, we're pushing that merchandise to the floor, because we can see the anxiety that's been created for our customers in this situation, and we're really proud that we're able to deliver that benefit to them. So when we're looking at what's open and what's closed, that's really the filter that we use. And how safely can we do it? What's the demand? How important it is to the Marine that lives on the base? And we're making decisions based on that.
Thank you, Beverly. And just hitting on the safety topic you brought up within the retail spaces, you mentioned a couple things that GameStop has implemented. What other things can folks in the community see at other retail locations on base in terms of safety precautions?
Well, yes, I'm sure our customers, if they've been in our spaces, they've seen a lot of visible signs of what we're doing to keep them safe. The hand sanitizing stations at the door and hand washing stations, the social distancing markers that we're putting at the queue lines. We've gone to a cashless environment, so nobody has to touch dirty money. And we put in the sneeze guards this week at the point of sale location to protect both our associates and our customers. So all those things are very visible, and what we see is our customers really get it. They are very willing to make those adjustments and what their normal shopping habits would be, and it works.
Thank you. Okay, and Beverly, this is another question from you, for you. In terms of the retail operations being tailored during this time, can you give us some insight on how that's happening?
Well, some stores do have reduced hours now because we have seen a difference in demand. We closed the Vineyard location because it's a 1,200 square foot store and it's impossible to social distance in that store. So those are some of the things that we're tailoring. We also will give more space to something that's in high demand, and we won't put emphasis on something else.
Thank you, Beverly.
So, let me add some to that. It's good to share how we tailor, right? So, one, it's very exact, right? The guidance at the highest level in the Pacific from the commander of INDOPACOM is that each base or group should take tailored measures based on the health conditions. So interesting enough, for the plan that Beverly is executing, a group of commanders and leaders understand what can be offered. We think very carefully about the groups on the base: GameStop, Young Marines, MCX, families and Young Marines, retirees. We look at that and then we think together, what can we keep open given the constraints physically? Can we maintain social distancing? We have a public health emergency officer who actually goes there and looks and says, yes, if you keep this open, we can maintain standards. And then when they meet together, demand that we think people want to have the good or service, and we can maintain the public health measures, it stays open. So it's a very exact tailoring of what Beverly's explaining.
Thank you. All right, back over to you, Lieutenant Commander Cornejo. In terms of the clinics here on base, how are they operating? How are the folks who are attending the patients, how are they faring? What's the overall operations in the base clinics like today?
Yes, sir. Thank you for asking. I get the great pleasure of working with over 45 civilian and uniformed folks to deliver care every day over there. What we found ourselves in a position over the last few weeks was to create, kind of from scratch, an entity to provide proper screening and testing and following all CDC guidelines. We've been able to do that with a lot of ingenuity, tenacity, ideas coming from what we say the deck plate in the Navy. So when we say that, we're talking about some of the most junior sailors coming up with a way to do this smartly and efficiently. Also with tremendous base support from Colonel Lianez and his team and others, with our own command. And so what we have now is a separate screening facility. It's located just adjacent to the clinic that you all know and are familiar with. And in there is a cadre of men and women that are able to provide the screening and testing necessary to screen for COVID. And they're able to do that kind of off-site. What that gets us is the ability to separate folks that may potentially be a bit more sick or fall into the risk categories from folks just doing normal business within the clinic, picking up medications or being seen for other things. And so they're able to proceed into the clinic, whereas these other folks will be treated for appropriately in the other facility. I'll say that at the same time, that same kind of ingenuity and hard work is applied to completely shift the way we normally do business. And as many of you have found out, or some of your families have found out, we're transitioning using technology as much as we can to do virtual appointments. And there's a lot that we can do in that manner by having the older, more traditional trudge into the clinic and get seen. We find that there's actually a lot we can accomplish through means of audio, and we're working on visual as well. So in that way, we're still able to readily meet our mission of taking care of over 7,500 retirees, uniformed, and family members.
Thank you, sir. All right, sir. So one of the hot topics lately has been the beaches here on base. As part of our base culture, those beaches are very popular, especially in a time like now. Can you give us a little bit more insight on why those two beaches, North Beach and Pyramid Rock, remain open, the decision to close the others, and what that means to the families and service members aboard the base?
Sure. The base, Marine Corps Base Hawaii, made of 3 separate locations: K-Bay on the Mokapu Peninsula, Camp Smith, Halaba Heights, and then we have our families living at Manana Housing. So as far as the Mokapu Peninsula, we know on before COVID-19 that our beaches and what we could do on the beaches was a big part of our duty rest cycle. As a military community, we are in a mission right now, which is to defeat COVID-19. And it is a mission like any other. Key to a service member is his or her ability after they work to really recover for the next day. One way we do that primarily as Marines, sailors, and service members is that we PT. It's good for our physical readiness. It's good for the emotional aspect of recovering and rest. And then we just try to relax. So on the Mocapu Peninsula, the beaches are actually a really good place to do that, to do those necessary things. If, while in COVID-19, you can still do the things that the commander has talked about, and Beverly. Social distance, meaning break the transmission chain between you and others, right? We have been able to do that on the beaches. It is a behavioral shift. What I've seen is that the community is doing well at that. Additionally, because it is challenging to do it, we have kind of have a coalition of leaders here and people. 3rd Marine Regiment has helped by having Marines remind them about social distancing on the beach. And then our lifeguards that are there every day protecting us. They have a really good microphone system. About every hour they remind people. And then before that, Comstrat and everyone else has done very good messaging, MCCS, to really tell people why we're doing it and then what we need to do to maintain social distancing. So we've closed most of the small beaches because it's really hard to social distance on a small beach. So Pyramid Rock, North Beach are the larger ones. They also have lifeguards. Fort Hasse Beach, large beach, does not. So those are the reasons. And those are the reasons and the mechanisms we have in place to keep our beaches open. One thing for sure, if we cannot social distance on the beaches, and they become it's a medical or a public health term, they become hot spots, we will close them. That is a responsible thing to do for the community, and we will not let the threat progress on those beaches unchecked. If it does, we will close the beaches down.
Thanks, sir. So the next question is regarding services to the base in the forms of contractors either coming on or leaving base, delivering goods. Can you give us a little bit of insight, sir, on the importance of those contractors and how the decision has been made to keep some flowing through our gates?
Absolutely. I'll go back to tailoring. Tailoring happens when you understand what you need as a base community, and those needs are usually critical to the mission. And then when you can identify those, you can tailor your actions. In this regard, we talk contractors, which usually are people that are coming on to deliver something to the base, to keep the Marine Corps Exchange running, to keep the clinic going, or provide a service, telephone wires, electrical, and other critical services that are not organic to the population on the base. So yes, you, aside from those that work and live on the base, kind of the team here, we will see contractors coming through and through our gates. But rest assured, they are doing the critical things we need to keep the base going during COVID-19. Now, some things. They're really good people. They're hardworking, and they want to do their job, right? But of course, good measures that help them help ourselves. So, at our gates, we are asking verbal questions to remind them to be, if they are presenting symptoms, that we alert them, and if they are presenting, they are not allowed access to the base. Before that, the base has contacted those companies and asked them, hey, we have a partnership with you. We need your help, but please make sure your employees that come to our bases, 3 of them, right, are not sick. Additionally, on the work sites, so we still have projects going on. We have 42 new homes coming to up up by Pond, right? And we have 43 active projects, a new MCX Mart, a new comm facility, some runway work. We want those to continue while we can fight COVID. So at those sites, those companies are actually doing their own measures. They're social distancing. They're checking their good employees. And we have a good command called Naval Facilities Command that actually runs those projects for us that are helping them adhere to their own measures. So yes, you'll see contractors, but they are necessary.
Thank you, sir. So we've got an influx of folks who express their gratitude for the golf course being opened up for use on the cart paths for families to take leisure walks, ride their bikes, etc. Can you explain a little bit the decision on the decision you made to open that up for the folks here to partake and enjoy?
Sure. Those of us that all of us, we've all met crisis in our life. You don't have to select a group. We all run into something. Early on, we said that no one owns all the good ideas. No one owns the good ideas. A lot of times, how you get through crisis is a good idea pops up. So we have an incredible group of people on this base that are about the mission. They're not about the money. It's called MCCS. So the idea to convert the golf course to something we now call the Grand Park came from MCCS. Think about our beach conversation, right? We want to provide outlets for the people that we're trying to take care of on the base. What better place than a big open golf course, right? You can go out there. It's naturally beautiful for a golfer, right? That's how they make them, right? So now it's naturally beautiful for everyone that's not golfing, right? That they can spread, they can walk their baby, they can PT. I've been out there probably every day since we've converted to the Grand Park, and people are enjoying it. I like to think that the memories that are being made by people, young Marine running, family walking with their newborn, people will think, what a great idea, by a thinking, caring population to turn the golf course into a park.
Thanks, sir. All right, sir. So we've kind of touched different aspects of where we stand as an installation in terms of protecting our force, mission readiness, and partaking in the whole of government effort that we currently are in. What's next for MCBH as an installation, as a community, as service members, from your perspective?
I believe what's next is probably, I think, known by everybody. That if you understand or watch the news, take in the publicly available modeling for the state of Hawaii, we know that COVID has a life cycle. That I think the data shows in the third or last week, April 21st, in Hawaii, that the modeling shows that we're going to reach a peak. Okay, and I'm not a technical expert, but we're going to get our largest numbers then. So you look kind of where we are now, where that is. We've done very good as a community on 3 installations. Recognize we're part of a large community with containment and mitigation. Wash your hands, use hand sanitizer, social distance. That prevents community spread. But it is likely, as cases rise, that the reality of spread could happen, right? It's actually mathematical. So I believe that for all of us that are in it together, not just the base, but our partners outside the gate, that we knew in the beginning that we had groups called high risk. High risk, meaning because of a condition or what they do, that is more probable that if they contract COVID-19, that the way it would manifest would be more severe. Okay, so as we approach the end of April, the 21st, the base will certainly, as a community, and I think it'll be mirrored everywhere else, to really understand who's high risk. I think they understand who they are, right? But to make sure they understand who they are, and what they should be doing as spread continues. Now, we knew in the beginning that we'd have high-risk people, but I think operations pattern. We try to figure out what to do first, contain and mitigate. We watch how the threat behaves. Now it is to definitely know who our high-risk people are and help them protect themselves.
Sure, thank you. With that said, I want to take the time to say thank you to everybody here on the panel for partaking and answering these questions. And before we sign off, sir, is there any last remarks you'd like to give?
Yes, I started with gratitude for everyone that's in it together. We're in it together. I also believe that we all should understand that this is going to end. This is going to end. And that we really have a choice as we go through this to become better at who we are. I am seeing people make that choice, because you can make a choice not to become better, to become a better person. I'm seeing people, more acts of kindness. I think we're looking at each other in our minds and figuring out what's really important. And that is, we should be gladdened by that. And I'm confident that when we continue to do this, like any other trial or crisis, if you choose the right thing, you will become better out of it. And I know this base, everyone that lives works on it, and everyone we touch in the community, that when we keep that in mind, one, we will pull through this, but we will end up being better people out of this.
Thanks, sir.